Well, good afternoon and welcome everybody. I am so delighted to welcome you to today's webinar. I think this is going to be an exceptional webinar. We've got two amazing speakers that will certainly talk about their innovative approaches to small house design. It's really taking the greenhouse model and really adapting it and doing some wonderful things with it. Before we get there, I thank you for putting in your name and your organization that you represent in the chat box. We will have time for questions at the end, and so there is a Q&A box, not the chat box where you're putting your name in, but there is a Q&A. So if you've got questions for Erin and John, please put them in there, and we will save ample time at the end for you to get those questions answered. So let's get started. I'm, like I said, really excited to talk a little bit about kind of what the Greenhouse Project has been up to and why I get so incredibly excited. So on the next slide, you'll see a bit about what our purpose is. It's been my honor and privilege to be part of the Greenhouse Replication Initiative since 2008. And I've been delighted to see the greenhouse model proliferate now internationally as we are in Australia and Canada. But when we go back to our core purpose, our mission, and why we do what we do, the Center for Innovation is the catalyst for person-directed living and empowered cultures in the community of one's choice. So you can see that connection to our mission, to who we are. And as we've joined forces with Pioneer Network as well, we have really wanted to expand our network. So let's go to the next slide. So greenhouse expansion, and I would say ongoing innovation, has been a part of the DNA for the greenhouse model since its inception in 2003. And here are some of the things that we've already been doing. Greenhouse cottages were initially thought to be for long stay residents only. We now have greenhouse cottages and homes for those that need rehabilitation. We have greenhouse homes that support individuals living with disabilities, ALS, MS, intellectual and developmental disabilities. We have PACE and Greenhouse co-located in one affordable housing community in Detroit. We have greenhouse homes mostly licensed as skilled nursing in the US, but we also have greenhouse homes that fit within the assisted living licensure and some as adult family care. So on the next slide, as we really think about what if, we can really think about how do we adapt our quality standards. The Greenhouse Project is a trademarked project, a trademarked model. And if we can think about what does it look like to adapt those quality standards to address unique opportunities. So what do I mean by unique opportunities? How many times have we had organizations come to us and say, I've got this many beds in my traditional nursing home that I want to move over to this site, and I can't get all of them over here unless I add more beds into more rooms, I should say, into each of those homes. So that would be one thing. Since COVID, I think we can all talk about the increase in development cost. So are there things that we could think about or do differently to really address some of those cost realities that we're facing right now? And I think the other thing is that second bullet. We're not trying to dilute the model by any stretch. The model has been tested and researched. There's an evidence base to it, and we don't want to dilute the quality standards. But what if we develop a process that could really determine adherence to the intent of what those standards are? So I'm going to go very quickly and talk to you about the expansion of the greenhouse trademark and what we aim to do to broaden our reach and to deepen our impact. We believe if we are thinking internationally, if we are really trying to think about where we want to go as we go forward, we've got to think differently, and we've got to think about what can we do using the greenhouse core values, those quality standards, to really address some of these opportunities for ongoing innovation and impact. So the greenhouse model, the trademark standards, there were 25 quality standards that Dr. Bill Thomas put together when he created the greenhouse model and the trademark that went with it. In 2021, the Center for Innovation Board they kind of got together and they said, well, let's organize these quality standards and let's organize them into 5 model elements, but order them around the core values and really what we're aiming to do. So from 25, we now have 18 quality standards. And so the board adopted these new quality standards. And so this is what the greenhouse trademark is ordered around. I'm going to go through some slides and I'm going to go through them very quickly. I will remind you that you're going to be able to get these slides, so you'll be able to drill down on what these quality standards really are. So here are all 18. And the first group is organized around the design elements. There are many design, I think when I talk to people about the greenhouse model, what they see first and what they often reduce it to is the design. And, it's a small house, small by private rooms and bathrooms, typically not to exceed 12 elders. So going on to the next one, here's another page of design elements. So there are about 7 design elements. And on that next slide, you'll see the second part of the design elements that really define from a design perspective, this is what we're looking at. But on the next slide, we get into our core values. And the physical design, those elements need to be incorporated into the idea of creating a real home. And I was talking to Steve McAlilly yesterday. He was the first to adopt the greenhouse model in Tupelo, Mississippi in 2003. And he said when his mother was there in a greenhouse home, she said to him after she had been out to the hospital and she came back, she says, boy, it's good to be back home again. So it's not home-like, it's real home. And so real home quality standards really help us define what is real home. How will we know it's a real home? What are the quality standards associated with the trademark that helps us really adhere to the model fidelity? On the next slide, as I mentioned earlier, it's not just about the physical design, which is what we see so quickly, but it really is that philosophy of care. It's about creating a meaningful life so that it's not just about a person being known by their diagnosis, but really understanding who that person is through deep knowing relationships, relationship-rich, person-directed living. So these are the quality standards associated with that core value of meaningful life. And on the next slide, last but certainly not least of our core values is empowered staff. An empowered staff, when I think about what it takes to really bring meaningful life, person-directed living to our elders and those that are living in greenhouse homes, it is so inextricably linked to an empowered workforce, to empowered teams. And while I want to see elders as unique individuals with intrinsic worth, I also want to see those that work there as unique individuals with intrinsic worth. So what does empowerment look like as it pertains to that core value? So these are the quality standards that are really important to the greenhouse trademark. And certainly we want to make sure as we expand our trademark that we are giving real thought to how we maintain this. And now, last but not least, model support. And it was important not just to frame it in design elements and our core values, but to really think about what does it mean to support the model fidelity and to really have that commitment as leadership to making sure that this is a model and kind of the integrity of the model for really aiming to accomplish what we have set out to do. So those are the quality standards. And on the next slide, to the process piece of it, we have created a trademark application. You're going to hear 2 case studies today of individuals, organizations that have undergone this trademark waiver process. There is a trademark application, and so there's a checklist of things that you need to do. We kind of get a profile of the project and what the organization is aiming to do. We go through the quality standards in much more detail than I just did with you. And then on the next slide, you'll see once that application is completed, they submit the application. We have formed a subcommittee of the Center for Innovation Board. It has greenhouse adopters as well as an architect that's on it. And, those that are really wanting to make sure this is not a dilution of the brand, it's an expansion of the brand. It has broadened the reach, deepened the impact, because we really want to kind of increase the impact and the imprint of Greenhouse Homes. So the committee reviews it. They give a notification to the organization to let them know exactly the next steps. So I'm going to get out of the way and now introduce our panelists. I'm going to introduce Erin Cobb first, and she will speak first, and then John Ponte. Erin is the CEO of Poitras Home in New Orleans, Louisiana. And it's been such a joy to work with Erin and to really get to know her and her commitment as a leader to the model. And she's going to talk a little bit about what she does at Poitras Home and what the trademark application has meant for her. And before you speak, Erin, I'll introduce John, and he will come on after. John, you'll speak right after Erin does. And John is the CEO of Southern Administrative Services. I got to meet John when I first joined the team in 2008 as the first for-profit operator of Greenhouse Homes. He has the distinction of having the most Greenhouse Homes under one owner-operator umbrella across the state of Arkansas. So after Erin, then he will pop on and share his story. So Erin, I'll turn it over to you.
Thank you, Susan. So as she shared, I am the CEO of Poitras Home in New Orleans, Louisiana. Poitras Home is a single site continuing care retirement community. Our organization, on the next slide, our organization is a very unique organization. We were founded in 1817, originally as an orphanage for female children of the yellow fever epidemic. And we are on a historic site in Uptown New Orleans on Magazine Street. We moved to our location in 1856, and part of our building is, does have this historic designation from that time. We were, like I said, founded as an orphanage, but in the 1950s, when foster care became the more popular model of care for orphaned children, they designated the site for a home for aging ladies. And in the 1990s, so it became a nursing home. In the 1990s, it expanded. In 2001, it formed independent living as well as memory care, opened and operated a day program. In 2018, we bought a home care company. And then in 2021, we were the first to break ground on a Greenhouse Home. So we are the only operators of Greenhouse Homes in the state of Louisiana. So again, a very unique history. I have been here at Poitras Home for 19 years. I will make 20 years here in October. And another bit of history about our organization: we are an all-female run organization. We are a nonprofit, and our board is an all-female board, and it has been that way since 1817. So just a little unique tidbit about our organization. So just a little bit of the timeline of our project. So our Poitras Home had always prided itself on being providing person-centered care. We were one of the only organizations that already had private rooms only. So we had the private rooms set up, but in a traditional model. We were using Hearthstone Montessori principles and working with individuals with memory loss. We provided a variety of different levels of care. We were the first to offer a dedicated memory care space here in the city of New Orleans. So we were already setting the bar high in this area for innovative approaches. But we were working with a very outdated building. Our nursing facilities dated back to the 1960s. Some were housed in the 1856 building. And then the most recent addition was built in 1995. But then, there was rooms that were lacking showers. They had no overhead lighting. So, as more competition came online, we were starting to struggle with, even with all of the wonderful things that we had to offer, setting ourselves apart, because of the challenges with the spaces that we had to offer. So in 2014, we did initiate the exploration of new approaches and new models. And after much research, we finally settled on Greenhouse. We traveled to their conference to begin learning and meeting with their teams. We went and traveled to individual greenhouse homes throughout the country, and then began the exploration and the financial modeling with the Greenhouse team. On the next slide, we can talk a little bit about the trademark waiver. So in the process of the exploration, our financial modeling, we discovered that it was not going to be viable for us to operate with the original sizes of greenhouse homes. So the number of beds either being a 10 house or a 10 elder house or a 12 elder house. We had 64 nursing beds. So there was no combination of the 10 or 12 number of beds that were financially viable for us. Poydras Home is a private pay community. And while, that is beneficial to us, that we're not relying on government dollars, it is still costly. And again, we wanted to make sure that we were following the model. We also determined through the financial modeling that we were going to have to bring on additional revenue to support the debt that we were going to incur with the new building. Our new building did cost $22.5 million to build. Other challenges in the bureaucracy of Louisiana and is that Louisiana currently has a moratorium on nursing beds. So we couldn't even go to a community, we couldn't even get additional nursing beds had we even tried. So we had to come up with some type of configuration that would add additional revenue, comply with the greenhouse model. And so we began discussions with them that out of the two buildings that we would build, one would be a 12 elder home, 3-story building having three homes of 12 elders each, all nursing homes. Our homes are vertical, and you'll see later in the presentation the photos of our new building. And then the other would be 14 beds. And 2 of those 14 elder houses are nursing houses, and the other is an additional, the added revenue that we needed, which was a 14 elder assisted living memory care. Because we couldn't add additional nursing due to the moratorium, there is no moratorium in Louisiana on assisted living beds. So after market feasibility studies, we did determine that there was the need for additional memory care beds at the time. So we moved forward with building those. At the time, Greenhouse was not, they had not said they were going to open up this trademark waiver. But then when we were in the process of building, I guess it was during COVID times, that they were going to open the door for Poydras Home to be one of the first, and the first trademark waivered homes. And so that is what our trademark waiver is for. It's strictly for the size. Again, size only. So on the next slide here on operations, we haven't changed the model at all. We operate the same way. The only thing that we have changed in regards to staffing is based on acuity. And it is somewhat based on regulatory requirements in the state of Louisiana and how you staff when you're staffing a vertical nursing home. So we have added a floater per floor on the second and third floor, because on those floors, obviously we have 26 elders per floor. So we do have a floater care partner on the night shift when each house only has the one care partner. That way that person can go back and forth. And then in the evening, depending on the acuity of the houses at the time, we have opened up that 3 to 7 shift. So we either have a day person who wants to pick up some extra hours who stays late, a night person who might come in early, a PRN person a PRN staff member who picks up a 4-hour shift, just to really help with that transition time of the 3 to 7 dinner transition to evening. But again, we have not changed the model in the way that the overarching staffing plans. We're still running, one nurse per floor, so one nurse covers 2 houses. And we're using the guides, we're using and we call ours care partners. Obviously, care partners. Most of the greenhouse homes call them Shabazine, but we do use the term care partners. I think the only challenge that we have faced is that those evening shifts can be difficult, that 3 to 7, and that's when we had added the 3 to 7 shift, and it really fluctuates based on the acuity of the house. We've got one house that is many of the elders receive a maximum level of care. And then you have another house where the level of assistance is more of a moderate level of care. So again, that fluctuates. And again, it's something that isn't staffed every day, but it's there and available for our staff to sign up for should we need it. But again, other than that, no changes to the way that we operate. So I'll share just a few photos with you. This is one of our homes. Our homes have absolutely no difference in the design from the 12 elder home to the 14 elder home. They're designed exactly the same. One has 12 bedrooms and one has 14 bedrooms. They all have the same architectural features, the same open concept kitchen, the hearth, the open family style dining space, the den area. You can see here the living space that opens to a courtyard. Poydras Home, even though we are a landlocked campus built on 3.5 acres of property, we do have a lovely courtyards and spaces, koi ponds and fire pit area that our elders can go out and enjoy. And the next slide. Again, our private rooms with the elders furnishing the spaces, the private baths with the lifts that are required by greenhouse. And I can tell you that has been amazing in and of itself, just the use of the lifts and not having that extra medical equipment laying around. And next slide. And this is just some shots of the exterior of our building. This is one of the more modern pieces of our campus. As I mentioned earlier, the main focal point of our campus is an 1856 building. But this is the exterior of the 2 buildings joined by this glass atrium. And then you can see kind of the winding paths with the courtyards in between connecting the 2. So that's it for me.
Thank you. Thank you so much, Erin. And I'll turn it over to John to provide some information on Texarkana. John.
Great. Well, look, it's nice to be with everyone today. Susan, I know Janet's got some slides that she's going to reel through, and I'll just kind of let her, kind of roll through it as she deems appropriate. And then a request of you, Susan, if there's something that I leave out in our question that or a particular point that you want me to make, just interrupt me. But again, glad to be with everybody. I'm John Ponte, the president of Southern Administrative Services, organization that's largely based in Arkansas, although we have a presence now in Colorado as well. 36 nursing homes that we client facilities, if you will, that we work with. 10 of those client facilities are greenhouse campuses, a total of 74 cottages, 12-person cottages. I can't even begin. I would have to sit down and do the math to determine how many more we have in the planning and development stages, but it's quite a bit. As Susan mentioned, we're a for-profit organization, which does not mean that we're devoid of mission. Our purpose, if you will, is to do well and to do good. But make no mistake about it. Y'all have heard the old expression, no margin, no mission. I don't care if you're a for-profit or a nonprofit or anywhere in between. If you can't make a margin, you're not in a position to serve anyone. What you see here is on the screen is a aerial view of our newest campus in Texarkana, Arkansas. And I'm going to talk about the waiver that we received from Greenhouse to build this particular project in a minute. But so I guess our journey is a pretty long and winding path. My background was in hospital administration, and got into skilled nursing intentionally in the early 2000s, and started with one nursing facility in Arkansas, which at the time was the smallest nursing home in the state. And after a desire to do right, to build environments of care that had a sense of purpose in terms of care and providing the environmental appeal that I think people deserve and want, most of which is rooted around private rooms and private baths and so forth. And at some point was introduced to the greenhouse model. And like many of you, instantly had 1,000 questions. How does this work? And can I make it work? As I sit here today, I can tell you that by any objective standard, by any metric that you want to throw at me, it works and works incredibly well. There's not enough money, capital, to build the number of greenhouse campuses I'd like to build. Each of which have been amazingly successful. And so we're very pleased with the model, very pleased with Greenhouse, and as I said, by any reasonable or any standard, any metric that you want to throw at me, they're incredibly successful. And so many of you know Greenhouse to be one self-contained pod, if you will, one self-contained, we call them cottages. And, all of you know that in life, it's entirely about trade-offs, okay? what's the best thing about greenhouse? Well, the best thing is that it is as close to a home as you're going to get. It has an environment of care that allows you to develop rich relationships between the caregivers and the elders and their families. And that's the magic. Okay. It's just intentionally small, and people have theoretical ownership and these deep relationships with the folks that they're caring for. And, that ultimately is the foundation of the model. But you start, what's the best thing about it is it's real personal. Okay. Uh, what do you give up? Well, I mean, it's small, and if you want to have a larger gathering, it's tougher, and it's expensive. Although I was listening to some of Aaron's numbers, and ours are a little different. Now I'll share some of that in a minute. And so, after building 6 or 7 or 8 campuses, we started to interview staff members and interview elders and interview some of our operational staff and talk about, if we could do something different, what would it be? I mean, if we were going to improve on the model, what would it be? And what you see here in front of you is what we came up with. What it is basically a double greenhouse. Okay. On each side here is a 12-person self-contained cottage. Okay. The only difference is they share a kitchen. All right. What's significant about that? Well, a number of things. Cost is certainly one component. Instead of, on this particular campus, instead of having, 10 kitchens, we got 5. Okay. Instead of having 10 fire systems, we got 5. Instead of having, it just, there is some cost savings associated. And our bet is, and was, that we could develop this in such a way that we don't lose the intent and the integrity of a 12-person cottage, and yet have some synergistic, development between two. And so, one of the things you'll hear from staff is they don't like sometimes being exposed to the elements. Now, sometimes they walk outside, it's beautiful. Sometimes they walk outside, it's raining. Okay. And if you can, start to limit some of their exposure to the elements, that's certainly a positive. Another positive in this is that we're able, when we have a shared kitchen like this, to hire more capable, qualified, dietary staff. Okay, and so instead of having someone cook for 12 people, they're cooking for 24 people. Okay, but you can hire a little bit more qualified person that's got more dietary expertise, and improve kind of the quality of dietary services. So that's what we were looking for here, looking for some economies. We're also, when you think about greenhouse, and I'm going to get in a little operational detail here. Basically, what you have is a 4-on, 2-off schedule. Okay, so you've got, folks on the right side in this 12-person cottage that are working, 4 days on, 2 days off. And then on the left side, 4 days on and 2 days off. And then you have a third team that's kind of covering the 2 days off of the full-time staff for that particular cottage. So there's one float that's kind of going back and forth. Okay. So when it's all said and done, this model really lends itself very well to 3 teams covering 2 cottages. It's that as well. And so, it provides a little bit more cross coverage. It provides, I think, easier access for clinical emergencies. our emergency drug boxes in close proximity now, and things of that nature. But there's just some operational efficiencies in it. There's some cost efficiencies in it. And quite frankly, Susan and I haven't talked a whole lot about this, but since Texarkana's been open and it opened in October, it has gone gangbusters. I can't imagine having more success in that very limited amount of time. Um, it's got a Q mix of 40 Medicare, and it's full with a waiting list in just a matter of months. And so interestingly, Arkansas is a certificate of need state as well. So you've got to buy beds. We went in and we bought a facility that was tired. I mean, I don't know how to say it any other way, but it was well beyond its useful life. But we're looking to buy the beds. And so this particular enterprise has gone from worse to first in this marketplace, and ultimately, we all seek to serve, but you got to go compete. This gives us the best opportunity to compete and to create an environment of care that quite frankly, people vote with their feet. And this is just yet another example of the greenhouse model at work. I mean, you get it right and you create the culture and you create the right environment of care, and have the right leadership. It can be the most dynamic skilled nursing setting that one could want. So this is our hybrid model, if you will. Again, when you walk in a greenhouse, the smell you should smell is what's cooking for breakfast or lunch or dinner. And in this particular greenhouse, in this hybrid model, that's what you get. This is a picture here of kind of the kitchen facility, and you can't see through to the other greenhouse. And so there is real separation here, but there's an opportunity for staff to kind of work back and forth if that's necessary. Jan, do we have any other pictures? Okay. This is our convivium area, our dining, and this is on one side of the cottage. And as Aaron said, one of the elements of greenhouse is this: you're building one 12-person cottage. In this particular case, we're building one hybrid 24-person segmented greenhouse. But what you see in the other greenhouses on that campus is the exact same layout. I mean, you're not designing you might have 90,000 square feet on the campus, but it's basically one building that you're replicating over and over again. So, Susan, I'd be glad to answer any questions anyone has.
Yes, we've got some questions, and I'm going to have Aaron pop on as well. John, talk about your payer mix and the percentage of Medicaid. We reference Medicare and such, but talk about that.
Yeah, and so we do take Medicaid. In fact, are very dependent upon Medicaid. It's been said that this model doesn't work on Medicaid. Well, it depends on the state you're in, and Arkansas is not the highest in terms of reimbursement. It's not the lowest. It's what I would characterize in the middle. But our greenhouses operate at a greater than 50% Medicaid census. So probably closer to 60% when it's all said and done.
Very helpful. And Aaron, there was a question, how long elders typically live in a Poydras home, one of the greenhouse homes? Probably hard to say because they're new, but any,
Yeah, so the greenhouse homes it's different, and I think it's changed even in a post-COVID world, and I think it's something we're seeing as a national trend. People are entering the nursing care environments later in life, and so the average nursing stays are declining. I'd say prior to COVID, our average stay would be 3 years. At this point, it's probably closer to about 18 months. But I mean, we're having people with less than 1 year stays now.
I think that trend is definitely, you're right. I think people are waiting till the end.
Yes.
And John, you talked about mission, and what are the metrics that are most meaningful to you to be able to meet the mission?
Well, I mean, if you look at care quality, our greenhouses, amongst our 36 properties, are at the top in terms of the quality metrics. When you look at turnover, they're the lowest. When you look at, marketing expense, they're the lowest. I mean, we don't have to spend a dime on marketing. Economically, perhaps the most successful skilled nursing environments in the state of Arkansas. I mean, and I don't have everyone's numbers in front of me, but we're certainly in the upper tier in terms of our financial success. And so when you look at across the board, quality of work life for our staff, and satisfaction of our and their families. Occupancy in the state of Arkansas, 66%. See, in our 74 greenhouse cottage with a waiting list. I mean, some of them have waiting lists that are ridiculous. I mean, no one will ever, I mean, they're so long that you might as well not get on them, kind of thing, which is regrettable. But it goes to the, success of the model.
100%. So talk a little bit about the monthly cost. And so, Aaron, we'll start with you. A private pay rate to be able to live at Poydras Home, and then we'll ask you the same question, John, for a private rate.
Our private pay rate is $10,350 per month.
Okay, and John, do you know what yours is? That was a per month. I don't know how you calculate it.
Yeah, ours, I don't know what the month is. It's probably about the same private rate. Now, our Colorado campus is I think $489
a day.
A day, and but it's in a little bit more dynamic market.
And that's what I would say to kind of give it context to Greenhouse nationally speaking. Where are you located? Are you in a more urban area where, there's opportunity? And certainly New Orleans would be in an area more like that versus rural Arkansas. So, it's not always apples to apples. A question, John, for cottages. How is mobility and movement for residents? Are they allowed to move in between the joined cottages? Can they go out on the porches? Are they allowed to roam around the campus or other cottages, or are doors typically locked?
Yeah, so there's not egress, open hallways between the two cottages in Texarkana. Now, someone wants to go see their neighbor next door. Well, they're certainly welcome to do that, and we're going to facilitate that. One of the things about Greenhouse, and I would tell anyone who's considering this is you've got an opportunity. You've got an opportunity to tell folks on the front end that this may not be for them, because we're going to promote mobility. We're going to promote liberalized diets. We're going to promote, liberalized med pass times and such. There's somewhat unfettered access to kitchens. Okay. There's unfettered access to the outdoors. Now, let's put that in context. If we've got, a campus, each campus will have those cottages that serve memory impaired folks and who are wandering risk. And those particular cottages have, systems to lock down if someone, tries to access the outdoors, without assistance. But most of the cottages, it's unfettered access, to the outdoors. Now, I will tell you, in greenhouse, I'm knocking on wood. I shouldn't say this, but I'm knocking on wood. We've never had a kitchen incident. We've never had an elopement. And that might be because people don't want to run away. You know, the level of satisfaction amongst the elders and their contentment, if and I dare say happiness, in this environment is at a high level.
Yeah, I'm 100%. And Erin, what about you for outdoor spaces at Poydras? Since you've got a vertical level, what does that look like to get outside?
So the ground floor homes have direct access to a porch and a courtyard space. And then the top two floors each have balconies that overlook the courtyards. So everybody does have access to the outdoors. Yes.
And what about caring for people living with dementia? We'll start with you, Erin, and then we'll go to you, John, to talk about that.
So we do not have, besides our assisted living memory care house, which is separate, in our nursing model, in the greenhouse model, we integrate those living with dementia within every greenhouse home. We do not have any dedicated memory care homes. All of our greenhouse homes have secured access. So swipe badges for staff to come in and out. So they are all secured in some way. So they are integrated within the homes. There is no separation.
And John?
You ask 10 people who understand greenhouse and who've operated greenhouse, you'll get 10 different answers. Do you mainstream, or do you put, people with memory impairment together? We put them together. We find it's easier to train our staff and to have, expertise and to have the systems available to support the needs of that particular clientele. Is that right or wrong? I don't know. It's just, what we found that works best. That said, and this has stuck with me forever, and it's one of the biggest truisms is that it's been said that greenhouse is the best non-pharmacological intervention for dementia. And it is. I mean, we think about what triggers people with dementia. It's the noise. It's the lack of insulation in terms of security and familiarity and people, I think, feel comfortable and feel secure and feel like they get in a routine in this deinstitutionalized environment, and they adapt and adjust very, very well. And I can just tell you from my firsthand experiences, I can't imagine a better environment for memory care, quite frankly, than greenhouse.
I'll just have to add to that because we did some filming at one of your cottages in Arkansas for our Best Life memory care approach. And you're absolutely right. And I think it's that deep knowing relationship when you really know who a person is. You're so much better able to support them to live a good life. And to your point, no elopements because they don't really want to leave. They're really having a pretty good time where they are and enjoying being integrated into kind of the fabric of life. With that, though, we have a question about risk. And John, you said no incidents in the kitchen, no elopements and that sort of thing. What about you, Aaron? Talk about risk and the quality of life, kind of that balancing risk with autonomy, control, and especially as it pertains to people living with dementia. And what about inspectors and surveyors, and how does that go over with them?
Sure. So obviously we promote the dignity of risk here at Poydras. I would echo what John shared in that we have also had no kitchen incidents, no elopements. We have been able to significantly reduce our number of antipsychotics and other pharmacological interventions. We're now below state averages, below national averages, where we were not before in our traditional models. So we're, definitely, looking at those quality outcomes that we were hoping to reach. As far as, those living with dementia, we are providing additional education. The state of Louisiana does require a certain number of hours related to specialized education for anybody working with individuals living with dementia. So we are completing that each year on top of the many hours of greenhouse training that we are conducting. What was the second part of your question?
I guess it was had to do with regulators and
surveyors.
Yeah.
Yes. So it was very interesting. So we've had only 2 state surveys in the greenhouse home since we've opened, besides the initial opening. And the first year, they came in, and I think they were just so shocked by what it was and so confused. They basically just sat in the office and did nothing. They would get up and walk around, and they would ask a few questions, and then they'd go back in, and we had a deficiency-free survey. So the second year they got a little bit stricter, and with more kitchens comes more opportunity for things to go wrong. So they looked a little bit closer at some things in the kitchen, and so we had to have some different training. But it took a lot of education from the staff and from the leadership team members, the clinical, regarding liberalized medication, the kitchens. We were in there constantly. Myself, I am an administrator, but I'm no longer the acting administrator. We're in there with the surveyors, having to explain things over and over, because they would just say, "We don't understand that. We don't understand that. Why are you doing it that way? We don't understand that." So there was a lot of confusion on this year's survey. So we'll see what happens. If we get any of the same ones, it might look a little different. But because we're the only greenhouse home in the state, so they have absolutely no experience in surveying greenhouse homes.
So John, you're not the only greenhouse home. You've got several. So and you've been doing it for a long time. So what about the survey process for you as it pertains to risk and deficiencies and concerns about that opportunity for autonomy and control?
Unremarkable. It's no better, no worse. They get it in the state of Arkansas. They get it. They've seen it for many, many years now, and everyone's got lots of exposure to it. And so everyone has their issues here and there, but it's no better or no worse. I think they treat us like they do everyone else. I think Aaron makes a good point. When you got 10 kitchens instead of one, you have 10 more opportunity to not temperature with some, but as crazy as that sounds, and most of you, if you're smart, you're thinking, oh my God, the dietary element of this is the hardest part. And it can be, but it's amazing how quick your staff kind of adapts to the routines of the elders and the needs of the elders, and they get their routine in terms of managing the dietary process. And so, you just got more opportunities for some dietary tags, but they're not significant and very remarkable.
Well, I think both of you have talked about the need to build that stakeholder relationship and really do the education for them. The other thing, John, something you said was intent and integrity. And I think that both of you have been very intentional about wanting to maintain the integrity of those quality standards and what we're really aiming to do as we've expanded with ongoing innovation. So thank you both for your time. And I want to transition and let our folks know that there is a workshop coming up. Janet can pull up the slides, but we're going to be in New Orleans in March 18 and 19, and we will be able to see, for those of you who are able to join us, we will be at the Poydras home in New Orleans, March 18 and 19, where we can really unpack it. And John has agreed, because he actually happens to live in Louisiana. He will be with us at the greenhouse workshop there. So if you didn't get all your questions answered, please feel free to join us in New Orleans. The next slide, you'll learn a bit about our conference coming up. And I think, Erin, you referenced coming to a conference, and certainly, John, you have sent many from your team to the Greenhouse Project or Center for Innovation Pioneer Network Conference. We will be in St. Louis, Missouri. I could have taken this from the hotel in which we will be staying in St. Louis. So join us there. We will be doing a small house summit at the end of the conference on August 14. So you want to make sure that you plan to be there for the entire time. You can see some other small house homes in St. Louis. Leading empowered cultures. I told you that what's so important about workforce and empowering your workforce to deliver those great outcomes. We are very proud of the Leading Empowered Cultures. Marla and the education team will be leading both a virtual or in-person class for Leading Empowered Cultures. And you can see it's accredited by the International Authority for Coaching and Mentoring. Next slide. This is Elder Care, Elevate Elder Care podcast. I love talking to some of the most amazing thought leaders. I have actually Dr. Kelly Tremblay, a Canadian, who is on the podcast this week's episode. Next week, you'll hear Steve McAlilly kind of share his journey to bringing the first greenhouse homes to the U.S. and his thoughts on retirement and succession planning. So I hope you'll tune in wherever you get your podcast, Elevate Elder Care, on Apple, Spotify, or Stitcher. So thank you, everybody. We really appreciate your time today. And certainly thank you, John. Thank you, Erin. I am just so delighted with your leadership and for your being willing to share your stories. So thanks, everyone. Really enjoyed having you today. Take care.